Subir, I want to ask you, the diabetes, what should be the diet of the patient?
So diet is very important aspect in the diabetes because only taking medicines or insulin may not help. If the intake of carbohydrate is more and you are taking medicines, that is not going to help as such. So you need to control diet. So I was going through a book called The Reversing Diabetes in 21 Days. So it majorly points towards your carbohydrate diets, which is rice, which is a staple diet for many of the people in India. So rice should be avoided. Potato as such is a huge chunk of carbohydrate which should be avoided. Nowadays they say, as per the new concept, the dairy products, milk and milk related products are not so healthy for the diabetes. So those should be avoided. And especially the jaggery, sugar, which are the sweet products, should be completely avoided. So if you avoid the intake of the carbohydrates, your sugar levels will be controlled. And the duration of the diabetes, which is the most troublesome factor in the diabetes, will have a limited implication on the patient's.
Secondly, what I listen from the patient is they don't say diabetes, they say sugar, and then they go for the you can say jaggery. So what do you feel? Ki jaggery is better?
Not at all. So jaggery is basically the same byproduct of sugar cane. So it's not going to have a different carbohydrate content compared to your sugars. So jaggery, sugar, everything is going to be a very dangerous thing for a diabetic patient. So both should be avoided equally.
Chital, see what should be the frequency of the diabetic patient to come to the examination to the ophthalmologist.
Okay, so ideally, every diabetic patient should undergo his ophthalmic checkup every 6 monthly if retina and everything is normal. But if there are any signs of diabetic retinopathy which are present in that patient, then ideally he should visit ophthalmologist every 4 monthly, and as and how his ophthalmologist advise him. If there are any intervention required, then he need to follow instructions of his ophthalmologist. That is the main.
Now, as you are retina surgeon, Sally, you tell me what happens in the retina or in the eye in the diabetes.
So basically what happens because of diabetes is when there is high sugar in the blood, it basically affects the blood vessels of the retina. So it starts with development of small outpouchings of the blood vessels which are leaky. They cause leakages, and then there are a lot of hemorrhages which come up in the retina, and there is macular edema. That's also one part of diabetic retinopathy. So diabetic retinopathy actually can affect the macula, that is the center part of retina, wherein it can cause edema or swelling. In layman's term, we could call that there is swelling in the center part of retina, which will affect your reading, writing vision, which will affect your clear, sharp vision. And also it affects the blood vessels, which cause the smaller vessels, the micro vessels, they get blocked because of the high sugars, and the blood supply to the retina is affected. That's why there is something called VEGF which gets released in the vitreous, which causes development of abnormal blood vessels. The aim is to provide blood supply to the retina, but these abnormal blood vessels are not normal, so they leak, they bleed, and then there is bleeding inside retina. Bleeding causes black spots coming in front of the eye, the vision reduces, there is decreased vision, and along with that, these bleeding vessels, they also pull the retina because of the traction, and this can lead to the detachment of retina at the end stage of diabetic retinopathy. So basically, if you're not treating it at correct time, then you may lose vision in diabetic retinopathy.
In India, the diabetic people are 12%. And when we think of the diabetes, we should not only think of that there is a diabetes and it is because of the sugar, but jaggery is also same responsible. And so whatever is there in your mind that the jaggery, we should go for jaggery is very wrong. And secondly, we should see for the diet is very, very important. Exercise is very important in the diabetes. And also you will have to also go to the ophthalmologist so that you will not have any ophthalmic problem, but you never come to the ophthalmologist. So a small part, if there is a small hemorrhage also, that causes the future problems. So like the Sally told us that there are so many things and that gives the blindness in the diabetes which is not reversible. So don't take diabetes casually, take it seriously, control your diet, control your tongue, and if you control your tongue and diet and also the exercise and you can say timely medicines, then your eyes will be with you throughout your life.